All right, hello executive team. My name is Sydney Kneller, and today I'm here to talk to you about why we should implement ambulatory care practices in our healthcare facility and what specific areas we should be focusing on to improve population health within the District of Columbia. So without further ado, let's hop into our agenda. Today, we are going to be reviewing some background on this topic. We'll then dive into the problem that the District of Columbia is encountering that is impacting our hospital. We'll run through some goals and benefits of implementations that are recommended. We will also talk through what partners will be needed for this implementation, talk through the timeline, and then we'll close out with some key takeaways and questions. All right. A little bit about the background of ambulatory care. Ambulatory care is care provided outside of the hospital, otherwise known as in an outpatient setting, which as a result encompasses a wide range of care and services. This means that patients do not have to stay overnight for intensive procedures that take place within an inpatient setting. Instead, these same-day medical procedures may include areas such as wellness, which would be preventative and basic medical care in a doctor's office. It could include diagnosis, which would be scans and blood tests. Could include treatment with same-day surgery, cancer treatments, and other types of therapy. And finally, could include rehabilitation, including post-operative therapy, OT, PT, and or addiction rehabilitation. All right, so the problem that we're experiencing at our facility as well as in the population of DC is, it has the highest homelessness rate when compared to 32 of the largest US cities, encompassing almost 8,000 homeless individuals, which is almost double the national average. This has led to a loss in revenue, increased rates of hospital admissions and readmissions, and higher mortality rates. So over time, our loss in revenue accumulates and closes in on our operating margins. And in fact, on average, homeless individuals visit the ED 5 times annually, but more frequent users visit weekly. Each visit costs about $3,700, which equates to $18,500 spent annually for the average homeless individual, and about $44,400 for more frequent visitors. So keeping in mind that DC has an estimated 8,000 homeless people, this costs DC hospitals between $148 million and $355.2 million per year, which is quite substantial. Additionally, almost 33% of all visits to the ED are made by chronically homeless individuals, and the in-hospital mortality rate is about 10% higher for the homeless individuals compared to the general population, displaying that healthcare outcomes are typically worsened for the homeless, unfortunately. So that brings us to our next topic. What are some goals and benefits of those goals that we can implement for our facility to address this issue? First of all, we can offer ambulatory care appointments for the homeless population. In fact, Boston Healthcare actually had a homeless program successfully implemented, which is very similar to this model for about 25 years going strong, and many components have been adapted by programs in many other cities as well. So this model involves delivering preventative, integrated medical, behavioral, and oral care to homeless individuals by providing care out in the community by multidisciplinary teams. This provides widespread insurance coverage, increased access, and consistent provision of preventative services, reduction of health disparities, decreased costs, and regression in many primary care indicators. Next, another intervention we can utilize, or goal that we can utilize, involves partnering with the people resources that are available to us. This includes social workers and community organizations or members or that can assist or provide outreach or advocacy. We will get more into the benefits on the next slide. However, the benefits here do include improvement in quality of life and health outcomes in population and health for DC. This would also really address both the long-term care plans as well as short-term care for the homeless population as well. Finally, we can incorporate clinical education and patient encounters to spread awareness around how actions and habits taken now can develop into chronic conditions and how to prevent those long-term chronic conditions from occurring. So, we're preventing rather than reacting to many of these conditions when we provide this ambulatory care, which is often more costly, involves more visits, and increases likelihood of negative healthcare outcomes. So, definitely would want to try and reverse those impacts by providing that education to our patients. All right, as I mentioned before, we certainly cannot do this alone. We will need to partner with others out in the community to make this or to pull off this initiative. One of our goals would be to partner with organizations and members in the community to improve healthcare quality and access. These partners can offer assistance, help with outreach, and like I said, provide advocacy for the homeless population in our area, ultimately aiding in their health and well-being. Social workers can intervene in clinical settings such as the ED to educate homeless patients on their options. These options could include resources to provide support for housing, for food, and other programs in the DC area that are eligible for their utilization. Community outreach and advocacy can also increase recommendations made by social workers who are employed through our hospital, as well as advocate for programs, policies, and funding that can be used to support the homeless population. Additionally, in the case of the Boston Healthcare for the Homeless program, the local governor actually convened a community coalition representing shelters and homeless service agencies, hospitals, community health centers, state and city governments, and HRSA's Bureau of Primary Health Care. These resources were specifically utilized for advocacy in the community, developing strategies for programs, funding, crowdsourcing, grants, and local policy. So this is certainly a model that we could implement for our facility as well to increase those patient outcomes. And then finally, the US Department of Health and Human Services and CMS both sit at the federal level. The US Department of Health and Human Services is federally responsible for protecting the health of Americans and the delivery of essential human services, including those who experience homelessness. This organization can help pass federal policies, funding, and programs that can benefit our hospital. And additionally, CMS can federally assist the homeless in attaining health coverage that fits their financial, physical, emotional, and social needs. All right, so let's talk a little bit about timeline for implementation. This certainly will be a long-term plan that we're looking at, but to begin, we'll need to partner with our finance team to determine a budget for an increase in resources to support these goals, as well as to offer services through our hospital, like ambulatory care. Keep in mind that these would be upfront costs. However, it would pay off over time as these goals limit the impact to our revenue stream that we're seeing today. Then we'll actually need to implement ambulatory care appointment access to the homeless population, which will take about 2 months to strategize and implement. So during these appointments, we would also need to deliver that education we talked about previously for this population, which will take about a month or less to provide that staff training and expectations that can then be delivered to the population during appointments. And then finally, partnering with the community will take about 3 months to convene a work group and begin planning or strategizing for policies, procedures, funding, and other assistance. However, this group will continue to meet over time and plan to, evolve to fit the needs of the population over time in DC. All right, so some key takeaways here are what we talked about today: homelessness impacts, goals, and outcomes. So over the years, our hospital has certainly accumulated a loss of revenue, higher rates of hospital admissions and readmissions, and higher mortality rates due to the inefficiencies that face the homeless population in DC. The recommended courses of action or goals to relieve the intensity of these impacts include that early intervention through access to ambulatory care, community partnering, and then providing sound clinical education. Results from these recommendations are known to decrease costs for the hospital, improve healthcare outcomes, and slow or prevent the progression of chronic long-term conditions. It can also decrease the number of visits to the ED and inpatient units and increase the quality of life by providing essential resources to the homeless community. All right, so I want to close out and ask if there are any questions today from our executive team. And if there's not, otherwise, I do have my contact information displayed here on this screen. You're always welcome to reach out to me via email. Otherwise, I do want to thank you so much for attending today. And there will be resources displayed here on the last and final slide to review if you'd like to know more about the information presented today during this presentation. Again, thank you so much, and I hope you enjoy the rest of your day.